See if I can see anything locked up.
Party planner Don Eisenberg is used to rolling with the punches, but
I think they've stopped thinking that they're going to stop.
And here comes the next one.
I am concerned about the rise in Omicron across Ontario.
The province's chief medical officer says more and more infected samples are now testing positive for the variant.
So we've gone from 10%, it may be up to 20% in the coming days, and then become a dominant strain, as in complete strain replacement of Delta by the beginning of January.
In response, Ontario joined several other provinces announcing those 18 and over will soon be eligible to book a booster shot. Ontarians will also need to start showing a QR code as proof of vaccination, and the program is being extended indefinitely.
We have more and better protections going into this holiday and winter season than previously.
Health officials say even with the looming threat of Omicron, a lot has changed for the better.
This time last year, we were experiencing double the number of daily cases and more than double the number of people with COVID-19 being treated in hospitals and in intensive care daily.
But health officials emphasize unvaccinated people are 32 times more likely to be hospitalized with COVID-19 than fully vaccinated people. And the latest federal data shows while a large majority of Canadians over 12 are now fully vaccinated, cases are still highest among children under 12, which is likely why officials pointed out with high vaccination among 5 to 11-year-olds and boosters for everyone else, hospital capacity will not be exceeded.
I don't think society has to close. I don't think we have to really suffer or go back to the terror that we had a year ago. I think we know what to do. We just have to do it.
As an event planner, we're always ready for the unexpected.
Which now means smaller gatherings, better masks, and good ventilation. Christine Burak, CBC News, Toronto.
Well, to provide some context and maybe even some comfort on all of this, we bring in Dr. Isaac Bogosh, infectious disease specialist. And Dr. Bogosh, as we've seen, the federal modeling suggests we could see some pretty high daily case counts in January. How concerned should we be?
I think we have to approach this with a healthy degree of caution and with respect. Obviously, there's still a lot of unknowns with this variant, but what we do see is that it is pretty transmissible and that it can cause infections and reinfections in people with prior immunity. Still, it looks like the vaccines are holding up and preventing people from having serious illness. It does look like a third dose is better than 2 doses, so I hope there's a degree of urgency, for lack of a better word, to roll out a third dose strategy from coast to coast.
And beyond that urgency on a third dose, what other things should we be doing to try to get ahead of this variant?
In all fairness, we should be vaccinating with those third doses, but we should also take care, really adhere to the public health recommendations that we've been hearing so much about. Better ventilated rooms, high quality masks, integrating rapid tests if they're available. These are the tools that'll keep us safe and keep our community safer.
A lot of people are finding all of this exhausting, Dr. Bogosh. What about for you?
Yeah, I mean, it is exhausting. It's almost 2 years into this pandemic. We all want this to be over. I think we're better prepared for this. At least we have the tools to do it. I just hope we do the right thing and use those tools in a proactive manner so we can stay ahead of this.
All right, Dr. Bogosh, as always, thank you very much.
My pleasure.